So tell me about your symptoms before our surgery. What were there?
Before the
Second surgery.
the SI,
Yeah.
I was just coming off of a lumbar
Yeah.
fusion.
Yeah.
Symptoms were still going away, or still there. You did diagnosed the SI
Yeah.
joint, and before the SI joint fusion, I was using a crutch
Mm-hmm.
to get along, or a walking stick to get
So
along.
actually, let's go a little further back. We saw you each other for lumbar spine, and those symptoms were severe, and we did a surgery for that. Actually, I think that surgery was. Do you remember when that surgery was?
That was 2 years ago in January.
Yeah, it was in 2018, 2 years ago, and you did recover from that. And
As
tell me
far
about
as that,
Yeah.
the symptoms that were directly related to
that lumbar
the
spine.
lumbar, then that was my third back surgery in that same
Yeah,
region.
but that
Finally
was-
had the first fusion.
Yeah, but that was our first surgery,
Our
correct?
first surgery.
So-
I wish I would have met you years ahead.
Then we
Um,
have to go even farther back now that
Right,
we started that. So, okay, let's go first surgery. When was the first surgery?
First surgery, my very first back surgery was 2012.
Okay, they did a decompression, macrodiscectomy, is that correct?
Yes. And then another one 6 months later.
6 months later. How were you doing after that?
I was doing terrible.
Okay, so it didn't really help you.
No.
Okay. And then
No, maybe feel very fragile.
of the very little of the symptom were gone.
Yes.
But then we put you through certain protocol, we maximized conservative therapy, and finally in 2018, we did that OLLIF, the minimal invasive fusion.
Correct. I was basically on bed rest before the
Before
OLLIF
that
surgery.
OLLIF surgery,
Yes.
yeah. And how were you after the OLLIF surgery?
I was amazed.
Mm-hmm.
I believe before I got out of bed,
Mm-hmm.
when I first came to, the pain that was going all the way down my ankle was
Mhm.
gone.
Okay.
Still a lot of pain and recovery.
How long did you stay in the hospital? Do you remember that surgery at all?
I was out the next day, I
Yeah,
believe.
yeah. I actually have
It
the
was
record
either
of
that or the next day. We did have.
Yeah. I have actually the record of the surgery. I'm opening it up, and but we can look at that. So, how long after that surgery did you were you able to do basic, life activity and so on? How long did it take you to recover from that surgery, the OLLIF surgery?
Oh, I think looking back 2 years,
Mm-hmm.
whatever you recommend as far as
Yeah.
what I was to expect
Yeah.
in healing, I was at that or faster
Mm-hmm.
than what.
No, I have the record of that surgery, which my part of the surgery was only 62 minutes. Our blood loss was 213 cc, and but you recovered. But now you had a different problem afterward. And let me give you a little kind of statistic. We know now for sure that 23% of the people who have lower back problem, their problem is not spine but the sacroiliac joint. If you had any kind of surgery, the statistic says that all of a sudden, if you have again back problem, that 43%, so almost twice as many people, if they had previous spine surgery, their problem is now sacroiliac joint.
Now that I've had the procedure and recovered, it's 4 months post SI joint fusion. That I was dealing with that SI joint for years.
Yeah. So you had two problems.
I did simultaneously had two problems.
Yeah.
And I think that SI joint wasn't just
Yeah.
a year ago. It was
It
years
probably
before.
has been, and this is our entire body is suspended by our lower lumbar spine and by sacroiliac joint, and they wear and tear at the same rate almost. So many times it's a combination, but again, this is a statistic. One of 4 people who have lower back problem, that's sacroiliac joint, and if you had a previous surgery, that almost every second person, if they have still lower back problem, that's sacroiliac joint, because sacroiliac joint, it's what we call adjacent segment to the lower lumbar spine. This is the next level to wear off, and unfortunately our body is like a machine that wears and tears at a certain rate. So we put you through serial injection. We noticed that this is sacroiliac problem, and about 4 months
the
ago,
SI injections worked almost.
yeah,
Took at least 50% of the pain away right away.
temporarily,
Before I even walked out.
but the pain came back.
Yes.
Okay, so
After a week or two.
yeah, here is the fusion when we see that the bone is growing inside. It's still outside, the bone growth is pending. And that's another thing that's why I use these screws that are hollow inside, because bone can grow inside, as you see right there. And my patient, after using 7 different systems, it seems that they respond with this system much better. But talk to me about your symptoms before the sacroiliac fusion and after.
Sure. Right up prior to the fusion,
Sacroiliac fusion.
SI fusion, I was using a cane or a walking stick to get around. Pain constantly, extreme burning in the front of my thigh. Then after after the surgery, the burning gone.
Okay. How long did it take for that burning pain to go away?
I think it was. I think the extreme burning was gone right away.
Yeah. And obviously, we ask you as well not to put full pressure on that site of the surgery.
And you won't.
Okay.
It hurts so bad.
Yeah.
There's a lot of pain after the surgery.
Yeah. Surgical pain. Yeah.
But
the
it's a fairly short period.
I'm going to now turn around and make it bigger, that this reflects the actual size of that screw. This is about actual size of that screw. And if this is a pen, you can compare that. And you have 2 of that, like 2 bolt 2 plugs, like a shotgun plugs inside of you. So it's normal that you feel that.
Still amazes me how you can put that through there with the incision.
That it's so little, yeah.
That incision was healed up. I went to the doctor right away. He's like, "You're
The
healed up."
incision is less than an inch actually in the side of the hip. I remember the times that I used to do this kind of sacroiliac fusion from inside in combination for other problems. This is easily used to be 4-hour surgery or 5-hour surgery, and losing half a gallon of blood, it wasn't anything unusual about that. Now your surgery was about half an hour and your blood loss was a spoon.
In and out.
Yeah,
I spent longer in the dentist
so
office.
we have come a long way. But how did you recover after the sacroiliac fusion?
Like I mentioned, just for people to expect, there's a lot of pain,
Local surgical pain
at that site.
Yep.
Pretty intense for a week or so.
Mm-hmm.
Then you can start to feel the improvements.
Yep.
And like I said, at 4 months out, I used a walker, not weight bearing, for all of a month.
So we are now 4 months out. Okay.
Yes. All of a month with the walker, and you'll know when you can start putting weight on it.
Yeah.
And then, like I mentioned, there's the burning's gone. If I overdo it, you can see that's not quite healed up.
Yeah.
But when I overdo it, I get a mild case and symptoms come back. Never burning, little numbness, little localized pain.
Yep.
And like I mentioned,
Yeah.
if you could take a snapshot of how I was right before that surgery and go now 4 months out, and have those two the day apart, it would feel like a miracle happened. Over time, at first it's a little struggle to get through that, but right now I can feel improvements weekly.
Excellent.
Distance walking, just mobility in general.
And that is important what you're just saying, because lots of people struggle with this kind of problem, and the awareness of the sacroiliac joint is still very rudimentary. Most of our surgeons, they are not trained to do that.
I feel fortunate to be one of the first ones to get this procedure. I'm looking forward to, I was a year out when I would say from my OLLIF surgery when I was, you said we did imaging, the bones were growing back perfectly. That was a successful surgery.
Well,
I have 100% confidence is the same thing.
Yeah.
A year out from this surgery, I'll never know I even had that issue. I'm confident of that.
Well, thank you so much for the interview. I really appreciate it.